my piece of paper, we are asking the compliance, what they are eating, how they are doing the thing. And it will show you really when they are stable and they are not complying to the diet, it shows you that they are not complying to the drug or adherent to the drugs which they are taking or to the diet which they are taking. The control group, which I told you, is really facing us and we couldn't control it.
Fairly informative. The other thing I want to make sure here that everyone know that Dr. Saud Ubaidi is very fine because I'm from the same faculty. I think he just didn't have enough sleep because of his new baby born boy. That's all.
Abdul Wahab is here. Have you heard now?
He's really happy because of his body weight and everything. The other thing, did you do any investigation on pregnancy and during pregnancy? Do you think that this can work also for females during pregnancy?
Well, no, we don't advocate really. It's for pregnant lady as well as the breastfeeding mother, and even the baby who are below 12 years, and it was supervised by some good doctor. I don't mind for them to apply fourth stage of this program, that they can eat as much as they want, but decreasing the amount of carbohydrate. Instead of 500 grams, they could have 150, 110, 120 grams of carbohydrate. But even then, because I don't have such study, I don't advocate for the pregnant lady to do this thing. Now, for the polycystic ovarian cyst, yes, the people who were for 12 years infertile, we did. We have got 7 cases, and majority of them, because after all, polycystic ovary, that means insulin resistance, majority of them. They are obese and they have got insulin. And once you control their obesity and insulin resistance, there is possibility for them to become pregnant, yes. Yeah. Now, if Professor Abdullah allows me, and open the consultation office here. Okay, I think within a month I'm going to open my private clinic. And here I can gain money more. Thank you.
Yeah, in your introduction, you did mention the role of that exercise can lead to ketosis, exercise on its own. Now, when you have these patients on ketogenic diet, do you advise them on exercise? Because there is a lot in the literature now that diet alone may not actually, be the answer unless it is, carried out with the exercise.
Yeah. I'm happy to, you are asking me this question. This question, one of the reviewer asked me also, and they gave me hell of time. That's why I know the answer very well now. Now, what happened, these people who comes to us, they tried almost all sorts of the dieting system. They've been in low calorie, they've been everywhere, and that's what the last source they come. Of course, I advocate for them. I advise them to go 40 minutes walking per day. Thing. Apparently, majority of them, they don't. Majority of them, they don't. But even then, what we advocate is 20 minutes, even in very slow rate, without any thing. We didn't find any difference between the 3 months where really we were insisting for them to walk 30 minutes, and with the long-term effect, which really we didn't find much changes, honestly speaking, because for 3 months, when we compared it with the 3 months, even these people who were walking, apparently they didn't lose much calories or much things. The beautiful of this low carbohydrate diet, I have to change it now, ketogenic diet, Mario will not be happy. So I have to say ketogenic diet. Now, in ketogenic diet, what happens when you are low carb, even you are sleeping, you are losing fat, you are burning fat. And that's the idea of it. As far as you have got fat in your body and you are avoiding all sorts of pasta and sweet, the body is utilizing your triglycerides, which is in the form of adipose tissue. You can utilize it. And that's the one thing. I think the reason, not because of walking, exercise, otherwise we could see all these people, you will see in the Cornish street, people are running and they are all flabby, fatty.